Thank you, Cheryl. Hold on to the mic because you started answering one of my follow-up questions, so you might as well fill it out a little more. You mentioned some funding that will be available to support collaboration with the Extension Disaster Education Network. Can you say a little more about what types of projects, what level of funding, what do you have in mind?
We're really still at this point kind of preparing the scope of those, but I think with our proposals in the past, it's been very open and coming up from our state projects. Those individuals that are involved within our committees will help shape some of what are on those. So I can see some of the educational opportunities that were talked about today. Some pilots with that information, some proposals to take the research and develop some fact sheets or information that would tie in and extend could be part of that. So stay tuned on that one. Okay?
Great. Go ahead and hand it back to Rubella. So I think I'm first going to ask Christy the question, and then Rubella has a chance to add on to what she already covered quite a bit of. And Christy, the question that I want you to address is from the NAHLN perspective. So you've talked a lot about the diagnostic side of the responsibility and test validation and ensuring that we have proper biosecurity protocols in the lab. And I'm curious how the diagnostic side works with people who might also be in the laboratory in terms of doing outreach and talking to the veterinarians and talking to producers about the problems they have and the role that biosecurity might play in managing those diseases. Can you speak to that a little bit?
Yeah, I guess on two different levels. The laboratories themselves, which again are primarily state and university laboratories, they typically have interaction with extension from their perspective, and they do get a lot of support from their producers, farmers that are submitting samples, a lot of questions, and there's a lot of interaction there. And then from the regulatory side, we work with our field staff, so we have our EPIs and I guess field veterinarians out there, and they interact with us on the management side as well as with the laboratories in submitting samples, collecting samples in the field and then submitting them to the laboratory. So I was lucky enough to go to the Eden annual meeting last year, presenting to meet a lot of people, and the interaction between the laboratories and the regulatory staff and Eden staff doesn't seem to be to a level that I think would be beneficial for our non-laboratories. So I think there's definitely opportunities out there to increase that interaction and support.
Yeah, so that's a great point. Do you know if there's funding that can support that type of collaboration, or are these collaborations that need to evolve organically to start with, and maybe a project then could develop that could be funded? What do you think about that?
So from the regulatory perspective, where I'm coming from, I don't have a lot of exposure to those opportunities. And interacting with Eden last year kind of opened my eyes to some of the possibilities that are available. But I think that's definitely an area that for NAHLN we should be looking into to have the lab support. I mean, it's not necessarily something that the program office for NAHLN would be a part of, but the laboratories themselves, I think, could individually or as groups within a region participate in that. And we would support it from the program perspective, but I'm not sure where we on the regulatory side would fit into that.
Sure. Yeah. Julie, can I add something to that? Yes, we have Dr. Michelle Colby.
Thank you.
Hi, Michelle.
Hi, Christy. How are you? So, unfortunately, we can't talk in too much detail about this because the award hasn't been finalized yet, but in last year's AFRI FAS RFA, there was a call for proposals for an agricultural biosecurity coordination network, and we are anticipating making an award under that category this year. And the whole point of that network would be to do some of these activities you were just talking about, to coordinate the networks that we already have under some of our tactical sciences programs, so the FADI networks, NAHLN, NPDN, and EDEN. But in addition, some of the other tactical sciences related programs we have, like the Food Animal Residue Avoidance Database, the Integrated Pest Management Centers, et cetera. But I think what we hope is that that proposal or that project will look beyond that and look outward and expand beyond what we consider our existing tactical sciences programs. More to come when that is actually officially in place. But I think that's one thing we're really looking forward to this year.
Awesome, thanks for mentioning that. Yeah, I think there is a lot of opportunity for the networks themselves to coordinate, and they play such a vital role in terms of detection and surveillance and helping us understand what the pest and disease threats are. And I think being able to connect with more on the research side as well as those on the extension, outreach, veterinary service provider side will really strengthen our overall capacity to deal with these agricultural biosecurity issues.
Yeah, so this ABCN, as we call it, the network that Michelle just mentioned, it's an award for 5 years. And over the time, the idea is to pull together the existing, what we call tactical sciences, which are programs that deal with ag biosecurity, both on the plant and the animal side, kind of to pull them together, coordinate them, and also to reach outside and bring them in. And addressing the question from the NPDN perspective, almost kind of similar to the NAHL, I would say we reach out to stakeholders in 3 ways. One is direct, because samples directly submitted from the growers to the labs. We would, interact with them and give them some idea of how to manage the things. Then the extension service also submits to our labs, and they use our diagnosticians as the confirmation. And since there's a whole chain of confirmation for detection in the plant world, it gets it can be a little trickier because we are looking at a very vast range of diseases that are coming in. And the third thing, which a lot of NPDN labs are also involved in, is looking at survey samples. So the researchers would often, or the extension folks often, reach out to NPDN labs and include them as a partner in a survey project. So there's a lot of interaction that happens on the plant side over there.
Great, thank you. I'd like to open it for any more questions from our participants here for our network panel. Chris. The microphone is getting to our next question here. Chris and then Ann. Go ahead.
Can I go?
Yep.
Thank you. I have a question for the last set of panels. My name is Chris Kaliba from University of Vermont. So our project has really been focused on the human dimensions around biosecurity adoption. It seems like these national labs networks are focused on diagnostic tools to identify the locus of the disease. How much coordination or thinking relative to the utilization of that information and the anticipation not only to track the disease spread but also to mitigate those disease spreads? So are there opportunities there to collaborate with these networks to help to evolve that thinking? I applaud the work that's been done over the last several decades to get the basic information, but are we almost ready? And it seems like the extension network may be also prodding this along as well, but how can the academic community and some of the kind of decision support tools that are emerging out of this could really help to accentuate and even further advance our abilities to defend our borders against some of these threats?
So if I take a stab at that, so one of the purposes of having at least the Ag Biosecurity Network is to trace a path of what are the gaps that we need to address. How do we translate things down to the actual application level, which would include the adoption and things of that sort. So those are gaps, and those are the requirements, I would think, that would the biosecurity network, once it comes in place, would also consider and put in. In addition to that, some of the programs that we look at on the IPM side do support some work which is not necessarily just diagnostics and detection. It is a lot to do with the applications, and Deb can also explain some of them. When it comes to IPM centers, also deal with those sorts of issues, and yes, that's a big thrust, I should say. And in addition to that, NIFA does have programs where they fund development of social science-based programs that are there that you could look at as well.
Christy, do you have anything to add if you heard the last question? She may not have been able to hear it. So I think Anne in the front had a question.
Thank you. I just, as the director of a very small, underfunded lab that struggles along.
Go ahead and introduce yourself.
I'm sorry. I'm Ann Lichten-Molnar with the University of Maine. I'm a veterinarian. I run our veterinary diagnostic lab, which is funded by Cooperative Extension. And I'm also involved in our One Health and the Environment Initiative on campus, so I'm an academic as well as an extension person, which raises lots of interesting challenges. One of which, of course, is keeping things operational and keeping them running, and trying to field a lot of different questions from an extremely diverse livestock and companion animal and equine owner population. So I was wondering, so with NAHLN, we would like to join that program, but one of the things that I'm going to need to do is make a good case with my extension colleagues about why that is important and why that works. So funding is always a really important part of that. So anyway, I'll follow that up later, but I want to say that my approach towards what I do and the way that I interface it with the rest of Extension is very much like what you're doing with the plant disease network. And so trying to make more of an organized case for having Extension colleagues be providing follow-up to cases that I initially take in the case. I run some diagnostics. I come up with an idea of what's going on. I extend that information to the client, and then having an Extension colleague come in and follow up, and trying to make that into more of a programmatic thing with some funding to back it up, I think could also implement those biosecurity steps that you're talking about. So I just wanted to throw that out there and get responses to that, if anybody has ideas. I mean, would that be something does that already exist? Or is that a model that we could follow on the animal side of what we do in cooperative extension?
On the plant side, I would think cooperative extension is looking at it from NIFA's angle, is funded through Smith-Lever's some standard dollars that go there, and that's one of the things which extension folks are expected to do. If there are outbreaks, if there are cases reported, they go to those locations and figure out what it is. I can talk of the plant side, and I know it does get done, and our diagnosticians work pretty closely with the Extension Service. It depends upon how many people you have on the ground in that particular location as to how much follow-up is feasible when it goes, very practically looking at it. In an idealistic world, yes, that would be great to do. I do not know what the situation is on the animal side. I don't know, Michelle or Peter, if any of you would want to pitch in.
I'll let Michelle.
So I heard the part about getting funding to become a part of the NAHLN, but I think I missed the part that Rubella was responding to.
So what she was asking is, it would be great if as a diagnostician you got a sample, and correct me if I'm rephrasing it wrong, is if you got a sample or you got a specimen, you diagnosed that there was a problem in a particular area, you passed on the information to the submitter, to have an extension person actually go and follow up and see if something had been done about it.
Okay. Yeah, I mean, I think I think the Smith-Lever funds, from a university perspective or from an extension perspective, are the best place for that type of a program. I think the other, if you want to take a slightly different angle on it, the National Needs Fellowships, from a graduate, a postdoc, doctoral fellowship training perspective, might be another interesting way to approach that, because those are not just single person training opportunities, but multi-person training opportunities. And that might be a way to integrate the next generation of people into this type of activity. Sure.
So at this point, we're at about 8:15, and our program will end at 8:30. So I'd like to open the floor to questions for any of our panelists at this point. So go ahead and you can let loose with questions that you were holding back earlier. And if you've got new ones for either of our panels, please raise your hand and we'll get the mic to you.
Reagan Adams, CSU. The concept of the shortage of a workforce to do diagnostics and be a veterinary service in rural America, where many of these diseases start, I mean, is something that is a challenge across our country currently. I've heard numerous times when people have talked about, oh, can extension, sort of help with animal disease outbreaks, et cetera. And at least the way I understand it, the diagnosis of a regulated disease has to be done by a regulatory veterinarian. So this concept that you kind of squeeze into having extension doing that stuff, I think that works in the plant world. It sounds like it works in the, oh, okay.
I mean, if it is a generic disease that is present across, say it's wheat stem rust, right, which all our extension agents, and also I should say here that the extension agents should get trained for the initial diagnosis. If you have an extension agent who has been trained, they can do a diagnosis for a very commonly occurring disease. But if it's a regulated pathogen, if it is something, I don't think you should totally rely on an extension agent.
I'll go so far as saying in the veterinary world, you don't.
Okay.
But there's a lot of people that think that groups like Eden, et cetera, some extension can be a workforce to respond to a regulated disease. I mean, they get stretched that way. You hear talk about that these days. And it's something that we have to, it's a slippery slope and it doesn't work, and it's a overextension of extension, who's already oftentimes overtasked and underfunded. So it's a very interesting concept how in the last couple of years I've heard about extension being put into this role, and I think one has to be exceedingly careful. Maybe it's because nobody from extension is going, we can't do that. So, but definitely with animal disease and a regulated animal disease, there's no thinking the local extension agent's going to fit in with that.
And I would just say, as an extension person coming out of the state of Wisconsin with a strong animal ag industry, I think one of the things we see is we know that it's the regulatory side of things, and helping extension understand some of those protocols. We have a lot of new extension staffs with some changes across this country, and so that's part of our forthcoming opportunity with Eden, is to have some of the conversation, and provide some of that professional development. But in your worlds, having, help provide that education to those extension staffs have us in on the conversation now. I heard somebody recently referring to it as like a blended opportunity, because if something happens out there and we haven't been part of that conversation, it's going to be hard for us to help, contribute to the information, to provide that education out there. Last fall in Wisconsin, we had a farm that was identified with TB. And in the dairy state, that really put up a lot of flags. Well, because I work with our animal health group in Wisconsin, we've made Extension what's considered from our Department of Ag a trusted partner. So I got the call ahead of time saying, we want you to know that this release is coming out. Can you put a notice out through your Extension system to be watching, for the media release, and to stick to that media release? And so it helps us from both sides of things, because then, our Extension staff was prepared, and to some of our educators who believe Google is a source of all good information, they're used to Cheryl saying, please do not Google this. And, it helps keep us in that trusted partner world. And to our producers, our other ag organizations, they know we're that trusted partner. So help build that in your local opportunities too. That's the part we can play when it is a regulatory situation.
And the diagnosticians often in the plant world are part of the extension service.
So, we just have to be careful, stay in our lane, but play on the team.
That's great. Is there a question here?
Just to speak to Reagan's point really quickly, I'm not blind to the realities of funding at the academic and the state level, but sometimes the issue is not having a position, but it's a recruitment issue. And in those cases, I want to put in a plug for NIFA's Veterinary Medicine Loan Repayment Program. There are Type 3 public service opportunities, and you can work with your state animal health official to nominate those in the fall. Those are limited to 10% of the awards, but that's just something to consider, and those are valuable for pulling in young veterinarians. $75,000 of loan relief for over a 3-year service period.
And in our state, we copied that.
And actually, since she brought it up, I just remembered also our postdoctoral fellowships has an add-on if someone wants to, and that's something which started this year. If somebody wants to work with Extension Service and get trained, they get an extra amount of money and time on a postdoctoral fellowship to do that.
Okay. So Gabriela Buccini again from University of Vermont. So we're talking about labs, and in our case, it's more of a technology lab. We work a lot with modeling, and now we're thinking about virtual reality. And I wonder whether there are programs that include money to develop these kind of labs, and whether there is a cap on this kind of on technology that we can buy, we can test, always related to research, of course, but is there something along these lines to develop like technology labs?
Pass the mic.
Yes, NSF has these technology competitions, and it's a lot of money. I mean, the small ones are like 10 million to 30 million to set up some kind of technology. This is what's used to fund the really big stuff. I mean, in my agency, the big money is in the so-called Toys for Boys. And ice cutter is expensive. It's almost $1 billion. The submarines can cost that do the deep sea diving. So there are technology competitions. Small number of awards, but they are substantial. Go to the website. I mean, that's the source of all knowledge as far as, and no, I mean, we'll in a solicitation we'll argue over the word must versus should. So it really matters what's in there. By the way, what is fatty money? I'm showing my ignorance here. It's something you guys ag. I mean, I have this image of ag with all kinds of money. So,
FADI is its Food and Ag Defense Initiative.
It's just one
Oh,
funding.
okay.
Yeah.
I thought it was F-A-T-T-Y. No, okay. Sorry, I'm just sorry.
Yeah, I deal with the nut shows why my health is what it is.
So I'm learning from you guys, I really am.
No, it's a funding line. It's a funding line that comes up in the budget, and that's the funding line that funds the networks, the 3 networks, NAHLN, NPDN, and ADBCAP. So.
Asim Zia, University of Vermont. Thank you very much for a fascinating panel. I have a question about the interagency announcements that you briefly mentioned and the bell rang, but that's kind of like shared between USDA and NIFA as well as NSF and other agencies. And the question is like different agencies have different goals, like basic science versus applied science versus, but it seems like this call is more focused on modeling, but my question is like modeling can have more, like can advance basic science, but also be usable for policymakers. So how do you evaluate, like what type of models would be recommended, like that would be funded?
So it's a model that, and similar to what you've heard about how NSF is going to fund projects, it's a model that is, the reality is it's meeting a particular need. But you're not going to be funded for that need. You're going to be funded because you presented that model as something that your study system is a model for a bigger issue that will be beneficial to other types of problems. An example, the National Institutes of Health funded a foot and mouth disease project. And you would ask yourself, why would they fund foot and mouth disease? And it was because it was presented as adaptive management of disease during active outbreaks. And so the proposal presented itself as, in the biomedical field, there are models for disease spread and things you can do to prevent it, or policymaker decisions that may be considered. However, once an outbreak begins, how do you shift the model? And particularly when there's more than one model. They said in the proposal, so for the beginning of it, the relevance, they mentioned not a word about foot and mouth. They mentioned the problem, the bigger problem, and then they jumped in with, we have a model that can be used to advance biomedical research as well as agricultural science. And NIH loved it, and they funded it. NIH also funded Merrick's disease, that's poultry, but they funded that, and you might ask, why would they fund that? And again, it was, they don't care about Merrick's disease. It was presented as, in biomedical research, as well as in agricultural sciences, there's still the unanswered question of leaky vaccinations. And if you continually vaccinate, is the pressure selecting for more virulent pathogens? So that was the issue. And oh, by the way, we have this poultry model that deals with a virus, and the industry essentially vaccinates all their birds, and so we have some really good data. That's how you go into this program. And therefore, you could be funded, what you're doing here, if you pitch it the right way, could be funded by USDA, it could be funded by NIH, or it could be funded by National Science Foundation. It's how you put it. You definitely don't write it like you do to a proposal that's going to NSF for very basic cool science, or to USDA for more applied agricultural outcomes, or to NIH for biomedical outcomes. And that's how you do it. Yeah.
Cool. Do you want to add to that, or? Okay.
No, I had nothing to say.
Okay. Yep. So we are about at the end of our time, so I'm going to go ahead and give final remarks, but are you guys planning to run out of the room, or do you have a few minutes if people have burning questions that they want to come to you with? So
I have
So-
a marathon to do.
So try to catch them if you can. Peter says he's going to be running a marathon, so good luck catching him. He's just kidding, but still, catch them while you can. And I think this has been a really wonderful session. I want to thank all of our panelists for being here and Christy being on the phone. Let's go ahead and give them a round of applause.